Thank you, Hans, and many thanks also to the IOM for inviting me here for this presentation. My name is James Fitzgerald. I'm from the Pan American Health Organization, which is the regional office of the World Health Organization here in the Americas, and it's also the institution of reference in public health for the Organization of the American States. And I was joking a little bit earlier, I think it's probably the shortest distance I've ever had to come for an international meeting of this sort, seeing that the PAHO building is essentially beside the State Department. So many thanks also for organizing it here. So I've been asked to speak on regulatory harmonization initiatives, networks collaboration in Latin America. I wanted to qualify the presentation by saying really the harmonization initiatives in Latin America, we can't talk about that without talking about the harmonization initiatives obviously in the Americas as a whole, but also within the broader global context, as many of the regulators within the region are also participating in many other harmonization initiatives. Here's a brief overview of the presentation that will look at what we've already heard a little bit about from Mike this morning on the Pan American Network for Drug Regulatory Harmonization. Some interesting initiatives coming out from the Americas on strengthening national regulatory authorities' capacity for regulation of medicines and biologicals, looking at some trends in regional cooperation and collaboration, and then based on this to see where we are. What are the perspectives? What are some of the considerations that we need to take into account vis-a-vis regulatory harmonization and convergence in the region? So some history on PANDRH. PANDRH is actually now officially 13 years old this year. It was established by the member states of the Americas in the Directing Council of the Pan American Health Organization in 2000. But it's actually really 15 years old because the first conference, I think, of the network was actually hosted by the US FDA here in PAHO headquarters 3 years prior to that. So we have actually a 15-year history in working in issues surrounding normative harmonization. If you look at the resolution, it speaks of, it's a very short resolution, very concise, with essentially 2 or 3 paragraphs in it. And it's quite interesting how at that time the perception of harmonization was considered. It's considered that it's a technical, that the member states should work to promote technical agreements on drug regulation among the member states, including multilateral, bilateral and sub-regional agreements with the participation of all sectors and interest groups. And so this concept has somewhat evolved, as we saw from Mike earlier on talking about PANDRH, into taking into consideration some of the asymmetries that exist really within the region of the Americas, recognizing that there are many well-established national regulatory authorities, but also some developing strong regulatory authorities, and obviously countries, low-income countries that really do not have the capacity and are not prioritizing, unfortunately, this issue at present. The network really prioritizes harmonization processes and promotes technical cooperation, and it has a formal structure that is defined in its statutes, and here it is. Essentially, the key to the network is the steering committee, which is composed of members from the sub-regional integration mechanisms of CARICOM in the Caribbean, Mercosur in the South, SICA in Central America, NAFTA in North America, and then with representation from the industry, from the regional industry blocks. The working groups are established based on requirements and priorities set by the steering group. And they feed their work program into the steering group, and the outputs of that are then presented to a conference. And the conference has additional participation of consumers, academia, and then professional associations. And I hope Mike is not too upset if I say that we're looking forward to organize the next conference in Ottawa this September, 5th and 7th. I'm saying I hope he's not upset because we're waiting on official endorsement by the Minister of Health of Canada. So that will be organized in September 5th and 7th in Ottawa of this year. What have been the outputs of the process so far? Well, essentially we have 15 technical documents produced by the network, by the various working groups. Here are some of them. I'll leave the slide. I'm not going to go through them all. But they essentially range from regulation of registration processes and vaccines to good clinical practices, to good laboratory practices, to some of the, I suppose, principal regulatory functions in which we've been working in as a region over the last 10 years. The last conference we had was held by and hosted by Anvisa in Brazil, and additional working documents were presented to the conference coming out of the working groups. and adopted by the actual conference itself. So these documents at present are under revision and publication, and will be available on our web. It was interesting also that we saw this morning some of the key words: adopt, adapt, and implement. This, I think, has been one of the areas that we need to explore more within the network. We've seen that there's been significant technical output from the working groups of PANDRH in terms of the products and product quality. However, now we really need to look 15 years on to see how are we in adoption, adaptation, and implementation of these documents, and essentially what is the impact, because that's really what we want to measure. What impact have these documents had? We have some empirical evidence at the moment. If we look at the GLP documents, technical document number 6, we know that 21 countries have implemented the guidelines. In pharmacovigilance, technical document number 5, 20 countries have adopted the norms based on this reference document in Spanish, of the document of the Americas. And that the vaccine common technical document, which is very much based on the ICH document, is being implemented partially in 14 of 17 and completely in 7 countries. However, I said this is empirical because we don't really know how to evaluate each of these individual categories. What do we mean by adoption? What do we mean by to adapt? What do we mean by to implement? Because I think, as Peter measured, we don't have any legal framework within the region to actually proceed with the implementation of harmonized norms. However, notwithstanding that, we do know that the technical guidelines are having considerable impact. They facilitate capacity building and development of the regulatory networks within the region. If we look, for example, at some of the same documents that I've just mentioned in good laboratory practices, we now have a regional network of 25 official medicines control laboratories that are working jointly through the region. Taking the pharmacovigilance document, we now have a network of focal points within the Americas that are working through a regional platform, a closed platform to share information. And the vaccine common technical document is really proving a very useful tool in improving efficiencies in the vaccine registration process. So what I think what we will be doing in the future is to, and we're actually doing at present, is to define a methodology to measure, to evaluate how we're actually, how countries are implementing these documents, and we hope to have a study completed by September for presentation in the next conference. One of the issues then is with implementation and adaptation of these documents. The other is the complexity of the integration systems that exist within, I'm sure, the Americas, but also globally. And this is just a very simplistic overview of some of those integration mechanisms. We have NAFTA in the north, we have Mercosur in the south, and now Venezuela has come into Mercosur. We have SICA in Central America, we have the Andean community, and we have CARICOM in the Caribbean region. And of course, we have APEC then, with participation from the US, Canada, Chile, Mexico, and Peru, I understand. So how can we move forward in harmonization processes when there exist these highly complex integration mechanisms which have distinct political mandates that are negotiating trade agreements amongst each other? So this is a real challenge, I think, for the region. In addition to this, we have, as I said, a number of multilateral and bilateral trade agreements. And then we have cross-regional mechanisms like ALBA that has now participation of various states that cross the regional mechanisms. And then, of course, UNASUR, which is now the whole integration mechanism for the Union of South American countries. So this is going to present a real challenge to the region in terms of moving forward the harmonization agenda. Taking this into consideration then, we began a process in 2007 of saying maybe we need to look at how we're looking at this issue of harmonization. Also, how do we move forward in implementing these documents? Do all the countries have capacity to implement these documents? So we started a process, a dialogue with some of the more well-established national regulatory authorities to see where these processes were going. The regulators at that time requested us to perhaps maybe shift focus and start looking at convergence issues built on established capacity within national regulatory authorities. So how do we move and link the normative processes within PANDRH that focus on technical harmonization documents with the health systems approach in building regulatory networks and capacity within the region of the Americas. This initiative took on such steam that it came to the governing bodies of the organization in 2010, and a resolution was adopted in 2010 by all member states of PAHO on strengthening national regulatory authorities for medicines and biologicals. As many of you know, resolutions on medicines can often be complex and polemic issues within governing bodies of international organizations. But I think we were extremely impressed as a secretary to see that this resolution had consensus from the north, from Canada down to Argentina, Chile, and from all member states in between. So there was real consensus around this initiative at the time. And it essentially requests member states to begin to focus on developing the regulatory capacity with respect to critical functions within their systems, and then to link in and support the work of the Pan-American Network for Drug Regulatory Harmonization. So it links the health systems component with the normative aspect that is required in order to adopt harmonized norms. What has happened since then? Well, we've begun a process really of assessing and evaluating regulatory systems within the Americas, and we are at the moment supporting a number of countries in the implementation of institutional development plans. And through the assessment processes, we have recognized, according to the resolution, 5 national regulatory authorities in Latin America as PAHO, national regulatory authorities of regional reference. What we've found through this process is that it has brought the countries together. It really has brought the countries together, and particularly Argentina, Brazil, Colombia, Cuba, and Mexico are now meeting on a biannual basis to develop joint work programs and are really, we believe, moving forward, particularly in GMP inspection, sharing reports, and definition of common areas of work program, common areas of work and work programs between them. At the same time, we've also noticed quite an increase in the number of bilateral and multilateral agreements between regulators within the region. This is just from, again, empirical data that we've requested from regulators. But we've seen, for example, that Brazil in recent years have signed 13 bilateral agreements between regulators, Mexico 5. There's an enormous amount of increased cooperation between the US FDA and Health Canada with the South, and for example we're seeing this very clearly in the initiative of the IMDRF, but also through initiatives in terms of the regional platform on access and innovation for health technologies at PAHO. And CARICOM signed through collaborative agreement with PAHO and the US FDA a cooperation agreement to see how the Caribbean region as a region can begin to move as a bloc and develop regional mechanisms that can then adopt harmonized norms through the network. And so recognition processes are beginning. We've seen 2 weeks ago, for example, El Salvador and Ecuador now to link in their registration processes with registration processes in Brazil, US FDA, Canada, Argentina and Mexico. And so through these assessment processes, what's happening is confidence is being built between the regulators, and slowly but surely we hope that these recognition processes will continue to develop. One of the critical areas for the regulators in the region is to have a secure environment in which they can have dialogue. And with the support of the US FDA, we launched last year at PAHO a platform on access and innovation for health technologies that we hope will facilitate the convergence processes. It has communities of practices around which regulators can convene. We're using it to develop the next strategic development plan for PANDRH, which will be presented in Canada in September. And it presents indicators as we work with the regulators to assess regulatory functions. It incorporates the indicators for the regulatory systems within the platform. Most of the communities of practice are closed, so you will have to register and request access before being provided. But it's been an extremely useful tool to bring these regulators together around specific issues, to promote the dialogue at the regional level, and to move forward in joint work programs. And so to finish, I wanted to give you some considerations and perspectives from this region. As we've seen from the complexity of the integration system, the regulatory harmonization really depends on the existence of a coalition of the willing as such, the political, economic and trade agreements and policies that exist within the integration mechanisms. But we have recognized as well over the 15 years of PANDRH that we cannot implement harmonized norms if we don't have basic regulatory systems in development and regulatory networks functioning. We do believe also that promoting the development of partnerships between national regulatory authorities and the development of regulatory networks is achievable in the short and mid-term, I suppose, as we move towards harmonization, and that modern technologies can facilitate this in the development of platforms. The PANDRH in future will move. It will not forget the normative guidance and technical documents that have been, I suppose, its core work over the last 15 years, But there will be, we believe, a shift towards the development and application of good regulatory practices, good review practices, and mechanisms to really support network development, not only within this region, but to facilitate the participation of national regulatory authorities in the region, outside of the region. And so there's a little notice also that the next conference, all these issues will be discussed in Health Canada in Ottawa in September. So thank you very much.
Thank you very much, James. I recognize that it's really a challenge to give us all this useful information and very interesting information within the given time limits. Thank you very much for doing very well. The third speaker on my list is Mike Ward, Manager of the International Programs Division of the Therapeutic Products Directorate of Health Canada. And he's going to talk about the Asia Pacific network. Mike, you have the floor.